Hey!
Hey! All right.
And we are here. And I have a pink glass in the frame.
Right. All right. So, welcome to the talk show. And my name is Romeo Versace Giovanni.
My name is Alexandre Leitão. Good evening to everyone.
And 960 subscribers. Yay, we're getting there.
Yay!
All right. So, today we're excited. We got two awesome people. They are, one is a surgeon, and the other is a OR nurse.
And I can tell you that no show on YouTube for photographers brought you doctors and nurses to discuss this topic.
Yep, we're talking about COVID, but we're not talking about it from a political side because that's political turmoil. We don't want to do that. What we want to do is get your questions on exactly what you want to know for photography and modeling. We want to keep all our questions non-confrontational, which means we don't want any of these, political statements. So let's keep it clean, let's keep it straight, and let's see what goes on.
So let's talk about our sponsor.
Oh,
do you know who is it?
Our sponsor today is Satellite 3D. This software is amazing. It's a revolutionary pre-visualization software that allows you to set up and use a multitude of equipment from strobes to set design to allow photographers, videographers, set designers, and more to collaborate and prep for their productions.
They are currently offering a 30-day free trial right now, so you can test out the product.
And Satellite has a community that is currently in beta. And this is an amazing feature of like-minded visionaries that provide already pre-made setups, as you see right here. For your certain vision, you can alter it, maneuver it, and have a great time creating new art.
With Satellite, you can regulate the output of the lights, add your specific type of lights, speed lights, define the space you are working in, use lampshades, screens, reflectors, and more.
This software allows for you to change light modifiers, the types of cameras, the lenses, adjust zoom, f-stops, ISO, you name it, it's there.
Satellite newest version even allows more creative aspects like color gels, color temperature, and even allows for a modeling light.
So join thousands of our visionary professionals out there and boost your level of your team by getting your hands on this Satellite revolutionary software today. Our link will be in the description.
And awesome. We are back.
Yeah, we actually did that without even reading something. All right. So now we're going to be talking about COVID. COVID has been in all of our lives. We've had everyone stuck inside their homes. We've had, it's just been crazy what's been going on.
I've been working from home since March. For the first month was really hard on me because I was so afraid that I couldn't even step out without take a shower of alcohol gel, Right. I got myself washing my hands and putting alcohol gel over it. So paranoid I was.
Oh man, I remember we went to the store one day. They had everything, and then the next day there was no toilet paper. There was nothing.
I don't understand. I don't understand how a flu makes the toilet paper vanish from the stores. Right? It's the same in Brazil. It's exactly the same.
It was like, what is going on? And then what's funny is I'm a gun guy, so I went and bought bullets just because I like to go to the range, and nobody was there. And then about a week later, all of a sudden, you can't find them. They were empty. And I'm like, what is going on? So then we were able to get toilet paper. So it was funny. It was like the opposite.
Are you still cleaning your groceries with alcohol gel when you get home? Because I'm still doing it. I'm still kind of...
No, I got antibacterial soap.
I get everything inside home. I got the bottle of alcohol gel and I put alcohol gel on everything before I put it in the fridge.
Yeah, you can do that.
All right, so let's bring our guests. I will bring one by one. Can you introduce them?
Yeah, let's do that.
Okay.
All right. So here's Mr. Stephen Puccio, right?
Yeah.
And he is an orthopedic surgeon. Why don't you tell us a little about yourself?
I'm an orthopedic surgeon. I've been doing it for about 25 years. I work in a little town called Hazleton, Pennsylvania currently. And I live in a smaller town called Allentown, or Walnutport. That's the one thing that I always liked about it was the fact that there's one traffic light. But I have a beautiful wife who's going to be joining us in a minute. We do a lot of things together, and she's made life a lot better for both of us. And we enjoy things, and we enjoy doing stuff together. And I'm just an average guy.
And a cool guy at that. I do have to say that.
And let's bring his wife.
Here comes Miss Kate Puccio.
Guys.
Kate, how's it going?
Good.
So, you just came from a dirt track race, didn't you?
Yeah, last weekend, Friday, I don't remember.
And
There's
tell
been a
these
bunch of them.
guys, tell these guys your background and what's going on.
Okay, so I became a model essentially to pay for nursing school. So I've been modeling since I was about 17 or 18. I graduated nursing school, I think, when I was 20. So I've been doing that for 12 or 13 years. I work in the OR. During COVID, we were kind of floating all over the place to floors. And I know my husband was working in the COVID tent for a while, so definitely stretched our nursing experience. But I also am currently Miss Racing Extravaganza, so I've been going to a lot of dirt races. I've still been continuing to shoot as safely as possible, and I'm hoping to share some of my knowledge with you guys tonight.
Excellent. All right. So we've had questions, for a while, because we've had this going, about 2 weeks? Roughly about 2 weeks right now?
Yep.
Yeah.
And we've gotten lots of good questions from our fans, I guess you could say. First one, let's just get into it. What are the most common myths about COVID-19 that photographers and models should dispel?
Oh, that's a cool one.
Well, I think part of the problem with COVID-19 is it's constantly evolving because it's a new virus and we continue to find out new information about it. So what we think might be the standard of care or the way that we need to protect ourselves from it, the CDC will then tell us there's more research and this is what we need to do. So what we understand is that we need to cover our mouths, prevent the spread of droplets, stay about 6 feet apart, and limit the amount of exposure with people that are not in our direct family. And those are kind of the known facts. But as I said, week to week in healthcare, it's constantly evolving.
Right. And how about you, Steve?
I think, I echo her sentiments. I mean, it's rapidly changing. I mean, we get these things that come from the CDC about, washing hands 6 feet apart, and it changes. I mean, we're in a situation now where my son goes to school where they're now talking about sending the kids back with being 3 feet apart. So, it's a level of comfort. But I think that if you do the things that you're supposed to do, which is wash hands, cover your face, and keep the distance, that has proven itself to be effective.
Right. Okay. And then, like, in the respect of photography and modeling, and Kate, you're probably better for this one. How do you think that the COVID-19 is going to actually change how photography and modeling is being done from this point?
So I have done a couple shoots since. One of the big things is we drove to our location separately. We shot outside. I know a lot of models whose full-time job is modeling, so they need to continue to do it. They do virtual photo shoots, which is not something that I do because this is more of a hobby for me. However, if that's your income and you need to do it, that's becoming actually quite popular. Photographers that do weddings, they still have to do them, but they need to work with lenses that work with social distancing. So, like any industry, I think that people are figuring out things that work for them. Also dependent on their comfort levels, but I definitely think that it's possible to continue with our industry.
Okay.
I get one. I saw in the news yesterday, the Washington Post published it, that the second wave is getting slower and less lethal than the first one. Right now, São Paulo, as we were talking before the show, weddings are allowed again. Can you tell our viewers what is if the world is coming back to normal, if we are getting safe or not?
I don't know if the world, if it's getting safer. For us, we're, here in the United States, I mean, we're starting to see an uptick in the number of cases in all the states, and it's concerning because we went through a wave where we had these high number of cases in states individually, and then across the country. I think the other day it was 55,000 new cases. So it's starting to go up because we're forced in the United States, because it's coming into winter for us in the fall. Everybody's being forced inside, which goes against one of the things that the CDC says, and that's to maintain distance of 6 feet apart. So it's very difficult when you have to maintain certain restrictions and spatial distances, and you don't have that ability because of the fact that we're confined to the indoors now. In the Southern Hemisphere, you'll be outside and the numbers may go down for you guys. And even in the southern part of the United States, they may go down. But as you get further north and the temperatures get colder and people are forced inside, it changes the game.
Right. How about you?
So for me in Pennsylvania, which is where we both live, previously the first wave, I think everybody was really scared. Every single person tried to stay inside their own home or, socially distance as best that they could. Now we're kind of at a place where the healthier people are going out. They're getting a little more adventurous. Of course, they're trying to do their best with mask wearing and such, but I knew one person months ago that had it personally. I now know about 12 people that have had it over the past couple weeks. All younger, all healthier. So this kind of speaks on one of the myths that we were talking about earlier. Yes, young people can get it. Right. It's not discrimination. It's not like this virus is only affecting elderly people, but the younger people are now kind of going out and trying to go about their business. And I think that could be part of the surge that we're seeing now is people trying to go about their normal lives. And those people who are more healthy and more comfortable doing that are actually acquiring it because they're lapsing a little bit on the social distancing.
Okay. So what's the purpose of these antibody or serology tests? So we have a couple of questions that people had asked.
Well, I mean, the testing, is designed to identify whether or not you actually have the virus. Does it change what you do? No. I mean, if you have the virus, you have to quarantine for 14 days. Right. It usually runs its course, but during that 14 days is when you're most contagious. So you have to let it run its course, and then at 14 days, a lot of places, depending on where you work and what you do, you have to be retested. And if you come up with a negative test, then you can return. I personally had a patient that was tested positive. I was supposed to operate on him, and he wound up testing positive a second time 14 days later. So, this kind of thing can happen. But, situations like that, you don't have any control over. But the idea behind the tests are basically to identify those people that actually have the virus. It's not something that quantifies, is it day 1? Is it day 5? Is it day 10? But it's just one of those things that tells you, yes, you have it, or no, you don't.
So would you say off of what he just said, would you say that it would be even safer if we went an additional like 5 days before we did anything? So we would give us that extra buffer if we were to have it, say?
Well, even if you have it, I mean, that extra 5 days, that's fine, that's great. But
Right.
I think what happens is that, you know, you're once your symptoms arise, okay, and you start to find the symptoms, you've probably been infected previous to that. So where does that day start? You know, you can't run around every time you have a sniffle, a cough, or whatever it is, testing yourself to see whether or not it comes back positive. I mean, if we get to the point where we have something that can tell you immediately, like a thermometer, where you stick it in your mouth and it says, "Oh, bang, COVID positive," then that'll be a wonderful thing, because then you'll be able to identify it much more quickly.
Right.
But I mean, sure, you can do an extra 5 days, but if you get to that point, you just get tested and it comes back negative, then you're clear.
And this particular person asked about antibody tests, which is different than a test that's telling you if you're currently infected. So an antibody test, which was, I believe, what they actually asked about, is going to tell you whether or not you built antibodies to the virus. So that means, have you had it? And one of the things with the antibody test is, with these vaccines that are coming out now, we're realizing that people only have antibodies for a select amount of time. So for the flu, you get that you get a flu vaccine every year, because that's how long the antibodies in your system will last. For COVID, for the information that we know, it's saying that your antibodies are only about 3 to 6 months. So just because you've had an antibody test that said that you had it does not mean that you're not going to get it again, because say 3 months, that's not very long. Now, the regular testing, the nasal swab, the mouth swab, those are testing if you actively have it. And those are the tests that you need to do if you're traveling to some states, some countries. We went to Alaska in June, and we had to have a test that was saying whether we actively had COVID. That is not the same as having an antibody test. And typically, if you test positive for that, you should assume that you were contagious a couple days before that. And for many people like myself, if I would test positive, I would have to have a negative test to return back to work. And they would redo that at around 10 days to 2 weeks. So those are two completely different things. One is showing if you've already had it, which does not necessarily mean that you're immune. You're immune for a certain period of time. And then the other test is saying if you actively had it. So say you're a model and you're planning on going to a shoot camp, which are kind of resuming, they're going to want you to have a test within probably 72 hours of entering your destination to see if you actively have COVID.
And that's actually another question. What is the preparation steps if you're gonna go to a shoot? Both sides, like model and the photographer. What are the preparation steps we can do to try to protect ourselves?
So if you're traveling out of state, out of your region, one of the things that you're most likely going to be required is a test within 72 hours that's telling you whether or not you have active COVID. And that's either like a nasopharyngeal or a nasal swab. A lot of places aren't taking the mouth test, and most countries and states do not accept the at-home test. So if you are planning on traveling to, say, an event, you're going to be expecting within 72 hours to have your results. A standard COVID test is taking maybe a week to come back. So you're going to need to make sure that you have a facility that can do a rapid test, or that you'll have your results within that amount of time. Within the network that I work in, there's like 2 places that you can go that you would get those results, and then every other place that you could get tested, it would take longer than that. So that would be one thing that you would have to plan for. If you're just shooting with a friend or somebody local, I don't think I would get a COVID test for that. I would just plan to be able to socially distance, wear masks. And it depends on your comfort level as well. Like I drive, I know that I'm exposed to COVID, so I drive in my own car. Obviously watch your hands, don't touch the equipment. and that kind of comes down to your own comfort level. But if you are planning on traveling to shoot, there are going to be requirements by the country or state, and you have to follow those in order to be in a situation that you're going to be able to enter the country. So always check the website of where you're planning on visiting. For Alaska, when we traveled, there were a lot of very strict rules that you had to follow. You had to have evidence that you had the test, do a waiver, you might have to buy insurance to enter a certain country. That should be something that you always look into before you plan on just buying a package and traveling somewhere as a model or photographer, and then realizing that you don't have what you need to enter the country.
Awesome. What do you, Steve?
I think the other thing too, in regards to what she said, is that I think you have to plan ahead, because I mean, there's a lot of places that you travel, depending on the state you live in and the state you're traveling to, that may require you, when you return, to quarantine for 14 days. So, I think that if you're going to these modeling camps or these shoot camps that you guys described, if you go to a camp that's in a certain state and your state requires you quarantine for 14 days and you have a job that you normally do, then you're not going to be able to work for that period of time.
Another thing that related to this topic is the fact that when you are a model, it's kind of hard because you cannot keep social distance from the makeup artist and the hairdresser. So what you do when you have this people who come really close to you, is just the mask enough?
So I actually just shot for the Phillies Finest calendar, and I was in that situation. I had to have my makeup done, and my makeup artist did wear a mask. I wore a mask when I wasn't actively having my makeup done, so when I was having my hair done, etc. We did not get COVID tested before this event because we were all fairly local. But we were asked to do a questionnaire before we came. We had to take our temperatures for a couple of days before. Of course, if somebody was feeling ill, they should not come. But we also know that COVID is able to be spread when you're not necessarily feeling ill. So that's not an indicator of whether you have COVID or not. But I think if you're sharing a room with someone at a camp or something, I would assume that everybody at that point would be asked to have a negative COVID test. When you are having your hair and makeup done, or there's no way to social distance, that's going to be up to the comfort level of you. It's better, of course, if the makeup artist, the hair artist is wearing a mask. Obviously, the model cannot wear a mask when she's having her makeup done, and that, you're in a situation where you're in close contact with somebody, so you're taking a risk. And if people don't feel comfortable doing that, then they should postpone what they're doing.
And talking about masks, Rome has one question that he want to ask since we scheduled the show.
The mask. Well, they got people that are using these little half mask, right? These little plastic, looks like they're only going like just to their nose. What's your thoughts on these little masks? We'll go with you, Steve.
I think they froze.
I think we lost their connection.
Yeah, I think they lost the connection. So you're not gonna get your question answered.
No. Oh, they'll probably be back. It's probably something down
They'll
there.
be back. I'll take them out from the screen for a few seconds so we can keep talking.
Yeah. So, I mean, if anybody out there has questions or anything like that, feel free to put them in the comments, because this is your chance. You can actually ask a doctor and a nurse what you're wanting. Okay. Follow us. Don't forget to
He remember, because we never remember that. Subscribe and hit the bell.
yeah. So do it again. So
anyway, while we wait for them to come back,
yeah.
We can talk about photography.
Yeah.
So I had a shoot. Was 2 weeks ago.
Mm-hmm.
I rent a studio here. I invite a model in, and I had to shoot with the mask for the whole 4 hours. It was my first shoot. Really trying to follow protocol. Steven's back.
Steve's back.
Was my
Hey,
first
Steve.
shoot. really trying to follow protocol, and was kind of hard
Right.
because I'm one of those guys that can only shoot through the viewfinder. Kate's back.
We didn't pay our cable bill this month.
Every time I breathe in and I breathe out, my viewfinder get fogged, so you can't see any shit.
And we're on the same internet, so I don't know what just happened there.
It's probably like our house where all of a sudden you get this hiccup and
My
all
son's
goes
probably
down.
playing like PlayStation using all the internet.
The band.
So, back to the question, which was, the half mask. Steve.
It's like a half visor. I don't think they heard the question. I think they.
Well, I heard it and then it went out. So that half visor is doing absolutely nothing. I mean, the idea behind the mask is to keep the droplets from being, if you cough or sneeze, from it being sent, at a distance. Because when you sneeze, I think the stuff that comes out of your nose travels at about 120 feet per second.
Wow.
So it's pretty quick. So that's why they tell you, either cover your face with your elbow or cover with a tissue to minimize that normally. But with the mask, that helps to cut down on that, and it cuts down on a lot of that stuff that's expressed from the nares or the nose and the mouth. But those shields don't do anything.
Right. And then
So Andy Reid sitting on the sideline, wearing that ridiculous thing that he has on his head is really not doing much.
Even
No.
the big ones? Even the big ones that cover your whole face?
It's still, I mean, it travels. I mean, and those droplets can be in the air for a period of time.
And that's what that was a question that I know we've gotten, which was in relation to the droplets. They're saying that it went 6 feet and then fell, but that's not true anymore, is it?
No, again, this is stuff that changes. It's like, you hear one thing one week and then the next week it's just completely different. So, you have to go based on the things that make the most sense. You have to use common sense, cover your face, cover your mouth, wash your hands, keep distance. These are the things that commonsensically are what you would do to minimize, even the common cold.
Right.
So
How about you?
Good.
So I think to expand on what he's saying, in the OR we wear a mask because if we would cough or sneeze into the patient, we would be spreading our germs into the wound and you would get an infection.
Right.
We wear eyewear in the OR because we're protecting ourselves from splashing that's coming from the blood, whatever.
Right.
So a shield is protecting your eyes from getting droplets in them. So that's protecting you, but it is not protecting the droplets that are coming out and then spreading into the air against everyone. That's what the mask is for. Obviously, a more filtered mask is going to do a better job. So like a KN95 or an N95. Now, N95s need to be fitted, but they're still a thicker material. Gaiters, face shields, they're not effective because they're not tight against your face, so the droplets are still able to spread out. They are protecting you from getting droplets in your eyes, but they're not protecting other people. And kind of the concept of everybody wearing a mask is if you sneeze, maybe it'll trap, and I don't know the statistic, but 90% of the droplets, that 10% is going to be trapped from the other person's mask before they get in your mouth. So yes, eyewear will help you. And as a matter of fact, as a nurse, when I'm circulating, I'm not near the patient. So there's a very low likelihood that I'm going to get, some sort of blood or whatever in my eye. But with COVID, we're required to wear eyewear because that is protecting us from getting the droplets in our eyes. And that takes us from like a low risk exposure to a high risk exposure if we're not wearing eyewear. So yes, eyewear helps or a shield helps, but it's not doing the job of a mask.
Okay. So is there a different precaution that you would take for indoors versus outdoors in a shooting session? Kate?
For me, I feel a little safer outdoors. I think it's because there's wind, fresh air. Indoors, especially like if you're traveling to shoot on an airplane or you're in a really confined room. There's air conditioning. It's sucking up the droplets, the virus, whatever, and recirculating it. So for outdoors, I mean, I still try to maintain a 6-foot distance, but indoors, I do feel like it's more congested, especially in something like a car or if you're traveling with your photographer. A lot of people in their car don't want to wear a mask while they're driving. If you're driving with another person, I mean, you're closer than 6 feet. And I prefer to be even further than 6 feet, to be honest. So I do feel more comfortable shooting outdoors with like a long distance lens. Like I did a shoot in a flower field. I did a shoot out by my pool. And the photographer was literally on the other side. And I had no concern about that. So to me, yes, I think outdoor shooting is safer. But that's just my opinion.
Right. Okay. And Steve, do you have anything to add over to the precaution side?
Again, I think distance is important. I mean, the further you are away from somebody else, the better off you are, unless they were tested before the shoot. I mean, and that's what it may come to. I mean, you may wind up having situations where when you do these shoot camps and stuff, where people that are coming are going to have to be tested beforehand, and it's going to wind up turning into like a bubble, just like the NBA did. And they did it very successfully. They had no positive tests during that whole period of time that they were in Orlando. So I think that type of mentality and that type of system works. It works well for certain venues and certain things, and it would probably work well for shoot camps. I mean, it doesn't take much to have a test done, and if you go and you have a test and it's negative, then there's a certain level of comfort knowing that the people that are there are negative, and that can then change your mentality as far as, okay, we can get a little bit closer and not have to really worry because the test was negative. No, it's not that you're going to be nose to nose with somebody, but it may make a difference in some of the things that you're shooting or some of the scenes that you're trying to shoot with the subject and the photographer.
Okay.
No, this is yours, Rom. You can go for it.
Even with all this PPE and preventive measures, we have lots of friends who are still getting COVID. So are these preventive measures truly working, or is this just a naturally occurring type of herd immunity? Oh, where'd he go?
I think the PPE that we wear, for the most part, does a good job. It only takes one small period of time to get COVID. You could go outside and, the guy who drops off your Amazon Prime package hands you the package, and he might have something and he's touched the box with the gloves and, and then, with his hands, and he's given it to you, and then you go and you wipe your face, and there you go. I mean,
so that might explain why I got it.
It can come from anywhere. That's the problem with any virus, with any bacteria. They're everywhere. So there's no way to avoid it. But again, there's things that you can do to minimize it. And that's the simple things: hand washing, masks, and distance.
Is there any real information about how much time it can stays in the air, the virus?
I think one of the last things that I read that it can stay in the air for 30 minutes, and it can live on cardboard and on surfaces for 3 hours.
Okay.
So I mean, but again, these things change because you got people that are doing studies all the time, and they find out that it can live actually longer than that because there's people actually doing that, and that it can. It's aerosolized in the air, and it's and then it lands on the surface, so it's up for 30 minutes, and then it lasts for 3 hours. So it can be there for a period of time. So, and that's why if you have people come over to your house, or if you get boxes from somebody else, you gotta clean them off. You gotta do something protective.
How do you think COVID-19 will change photography and modeling from now on? For the next few years, because It will take some time to we really get safe
For
outside.
Kate.
So I think we talked a little bit about this earlier, but definitely people are getting creative. People are doing like virtual photo shoots. Modeling is not my full-time job, so that's not something I do, but there are people that this is their livelihood and they need to figure out how to make it work. So people are doing virtual photo shoots. People are having to plan ahead a little bit more in terms of who they're going to shoot with. There's a lot of models that travel like for their career, like they will go on tour. Obviously, somebody that's doing that is probably going to be at higher risk because they're staying at hotels and traveling and meeting people from all different states. And of course, there are certain states that are green that have almost minimal cases, and then there are states that are red. So I definitely think that it's going to take an amount of adapting. But like any job or any career, I think we're going to figure it out. I don't think it's going to stop people from doing their jobs. I know it certainly hasn't stopped me. But I do think, every day I could potentially be exposed. So I want to take it seriously that I could be exposing somebody else. So like I said, if you're not feeling well, if you have any suspicion that you might have COVID, if you've come in contact with somebody with COVID, just postpone the photo shoot. You need to be honest about it. And I think we need to be considerate of other people that we're shooting with that might have pre-existing conditions or anything like that. So I kind of take my shoots day by day.
Right. So, Kate, you're a model and a nurse, which is like awesome. Just to let you know. How can a photographer and a model protect themselves if a client still wants to photograph? So, for instance, say we have a COVID specific liability waiver for the client. Have you seen anyone with this type of waiver?
Yeah, so actually the racetracks that I go to have a waiver. You have to fill it out one time and then you got like a little receipt that you've done it. You are assuming a responsibility anytime you're going around somebody that's not within your immediate family that you're going to be being exposed to COVID. But I also consider I'm assuming the responsibility that I could be an asymptomatic carrier because I know that I'm coming in contact with it. So as I've said before, you need to be honest with the person you're shooting with. I always tell people I'm a nurse. There are some people, I have not seen my mother since March. She will not leave the house. She will not see me because she knows that I am being exposed daily. And we are also not testing as many patients as we used to be. So I could be taking care of a patient that has COVID and I'm in the OR. I don't know. I may not know. And even though I'm taking the corrective measures to make sure that I'm not getting it, I could be a carrier. So I think COVID liability waivers, they're fine, but it doesn't substitute the responsibility that you have to be honest with the other person and communicate about, I'm a nurse. Hey, I'm exposed to COVID. Are you comfortable with that? And you need to take it at that. Now, if you're doing a camp or you're in a situation where you're shooting with another model, you might be sharing a room with somebody, that's different. And and personally, I would get tested before I did that.
Yep, 100%. I think that's something that every photographer, if you're going to do a camp, test 24 hours before you go. Right. I
think I've been tested maybe 7 times. We're going to Aruba in like 2 weeks and we need a negative test to enter. And then in order for me to not quarantine, I either have to take my temperature every day and wear an N95 or I have to be retested. If you have any doubt, if you're going somewhere, you're sharing a room with someone, if there's someone that's uncomfortable, you can always consider getting a test, which is not 100%, but it
or consider getting a separate room.
It makes me feel comfortable. You could consider getting a different room, but models shoot together. So, that's always something you could say, hey, I really want to do this. Are people getting tested? It's about communication.
Right. And that's the important part is communication. Because.
Sorry.
No, go ahead.
Go on.
Because it's like, if you don't have good communication, you could actually end up hurting yourself really bad. Like you guys know, I caught it. We've already determined that I caught this in February. I was buying a lot of stuff from Amazon, so I do think that might have had a good point. But at the same time, it sucked.
Right.
I mean, you can't breathe.
And there's a lot of people that are more unhealthy than you and I baseline that might have a pre-existing condition that thinks,
Right.
okay, there's this person that, has not been exposed. They're coming to shoot with me and you could be a carrier. So I always think being honest and, discussing their comfort level is like an absolute must. Getting tested is not a big deal. If that's what it takes to feel more comfortable to be able to pull off your shoot or whatnot, okay.
Right. And now, Dr. Steven, what's your thoughts on the vaccine, if they ever come up with one?
Well, vaccines are usually it's a dead virus, so it's inactive. So the chances of getting anything from it are slim and none. That's what the flu virus is. The flu vaccine is. If they come with one and there's one that's approved, right now there's several trials that have been put on hold because there's been some hiccups and there's been some people that have gotten some side effects that they have to determine whether is it a result of the vaccine itself or was it as a result of something that they were actually going to get regardless of the vaccine. So they have to determine that. But once they determine that, the next step is for them to restart some of those trials. And I think one of the trials just was given FDA approval to restart yesterday or today. So, those vaccines, once they come out and they've been given FDA approval, that's kind of, given the blessing from the government that these things are indeed safe to utilize after they've gone through the amount of testing and research and everything that they go through to get approval. So, when it comes to the vaccine, as healthcare providers, my wife and myself, we're going to be one of the first people that are offered the vaccine, and you have to take it because there's probably some places they're going to make it a mandate that if you're a healthcare worker, that you're going to be required to have the vaccine. Elderly people are going to be the same way. Elderly people are at high risk, nursing home patients. So, there's going to be people that are going to get, these injections in nursing homes, and it's not going to be just one injection, it's going to be two. It'll probably be one injection, and a month later you'll get a booster shot.
So kind of like the anthrax where we had to go like 7 times.
Exactly. So, it's
just, I'm being honest.
Yeah. It's one of those things where, it's like, diphtheria, the DTP when you give it as a kid, or measles, you get a shot and then you have to get the booster shot to kind of give it the kick. But that's what they've identified at this point is that you're going to have to get 2 shots about a month apart or 6 weeks apart.
I just want to make it known I hate shots.
Makes 2 of us.
I don't care.
I'm the one that climbs the wall.
Yeah, I just got my flu shot the other day. Some of the nurses that give them are very good about it. So, but then there's others that are beasts, and they, it's like they're trying to murder you with the needle.
And as
Shots
good as I know,
fast.
Kate, she's the murderer.
No.
Don't lie. I can already. I know you. You'd be like,
she's actually the victim because I actually have to give her an injection.
Yes, that is true, and he is not.
I love it.
Oh, come on.
Nice.
Shots.
How can I not be nice?
Shots work faster than pills, so I prefer shots.
Oh, we got a
It's not
question for
pleasant.
Steve.
He's the murderer.
We
So
got a question
Steve,
for Steve?
We got a question.
Uh-oh.
Is the coronavirus expected to be a reoccurring, perhaps annual or seasonal outbreak like flu?
Oh, so let me just put something over it so you answer at once. There's info out there on a second virus called COVID-21 expected by 2021. Have you heard about it? Can you tell us more?
I haven't actually had a chance to read the newspaper much or do anything on the internet when it comes to that kind of stuff. But we were just talking earlier, and you guys mentioned it. I think what's going to happen is it's just going to be like the flu. I think it's going to be recurring every year. I think what's going to happen is that as we go, we're going to develop some level of immunity to it, which is going to help to reduce the extent of the intrusion of the virus into our lives. Is it going to be completely eradicated? I highly doubt it. I think it's here to stay. It's just going to be a matter of
So
how
it's
we
similar
learn
to
to
like
deal
the
with it.
H1N1.
Yeah, I mean, it's going to be around. I mean, it's just not going to just, unfortunately, there's some people that think it's just going to miraculously disappear.
Right.
But, I don't think that's the case. Um, and if it does miraculously disappear, then that's just really bad. But I think it's going to be around. I just don't think something like this, something that has had this much of an effect on our lives, on our economy, and on our day-to-day living, that just disappears.
Right. Well, hopefully that answered Mr. Beer's question there.
And
So,
this brings us to another topic, because if it's recurring, so we can get more lockdowns and we can keep into this situation like coming and going for a long time.
Well, again, I think it's going to be how we deal with it and how we learn to deal with it. Yeah, this was the first go around. What happened at the end of last year and the beginning of this year, this was the first time we had something like this, of this magnitude. I think what's going to happen, or at least I would think that I would hope would happen, is that as time goes on, we learn how to deal with it. We have vaccines that help to minimize it, and we have medicines that also help to treat it, so that the effects that are there don't have as significant of an impact on our economy and our daily lives. Because I mean, we can't just shut down life like we did before, because if we shut down the world again, we're going to have a big problem.
it's going to be a big problem. I agree. So,
I mean, this is going to have an impact on our economy and things that are based off of our economy for years to come. This is not just going to be, okay, it's done, it's over, we got it under control, and everything's going to go back to normal. I mean, you're seeing it now. I mean, you've got airlines that have, people have been laid off. You've got amusement parks in California that there's nobody working. They're not open. They haven't been open for 7 months. You've got, people that are losing jobs, and the jobless rate is just going through the roof. This is not something that is just going to reverse itself and just change overnight, because there's all these businesses that have closed and folded because of this, that aren't just going to reopen and pop up again.
I agree. And there's photo studios that are completely shut down now because they have nobody going to them. People are scared to go to them. And that's kind of what we're trying to get with this show, is that not to be afraid to go. It's just make sure that photographer is taking those precautions. And
you can't stop living. I mean,
Right.
My wife and I, we go to work every day. We walk into the middle of a disaster potentially every day. Okay, you walk through a hospital, it could be there. You could walk past a room, it could be there. So, and we've traveled, we've gone to Alaska, we've gone different places, and we don't have it. We think we might have had it earlier in the year. Okay, but you can't stop living your life.
Right.
Okay, you have to just take the proper precautions and do what's medically recommended to reduce your chances of this happening. And if it's going to happen, it's going to happen.
There's no, unfortunately, it will happen. If it, at some point you get it, there's no way to escape. We are trying to reduce, to flatten the curve, but at some point you're going to get out and you're going to get it. You cannot just shut down economy and stop the whole country because of that.
Right. You can't stop your life because of this. They talk about it in surgery. You operate on enough appendix, you're going to find one that's normal. Okay. It's the same thing. I mean, you go out enough and you go and you do enough and you interact. Okay. It's going to happen. We go to these races, nobody's got a mask on.
Right. And she has a cute mask, by the way. I saw it.
Oh, she has. I got on the turn signal on my car. There's about 30 of them for every different outfit.
You know, I totally believe you. I know she does. She's got one for every shoe too, right? Every pair of shoes got one.
Every pair of shoes. Everything else.
Come on.
Go ahead, Kate.
Honestly, I've taken my son and his friend on vacation. We all went to Alaska. We all went to Virginia Beach. I went to my graduation, and for me, it's more about protecting other people because I don't have any immunocompromised. I don't have any conditions that I'm concerned about. And for each person, they have to weigh their own options. I mean, we go to races, and there's not one person wearing a mask, and there's thousands of people there. And I'm not saying that's responsible, but when I'm there, I then take every action they can to socially distance because, I don't want to be the person that maybe goes to a super spreader event. So, I don't hug people. If I take pictures with people, I try to wear a mask. If I'm shooting with somebody, I always ask them, and don't be afraid to ask people to wear a mask. If you're out at an event, maybe not. But if you're shooting with somebody, say, hey, I need you to wear a mask. I don't think the masks are like a conspiracy theory that people are trying to be controlled. We wear masks every day as an OR nurse and as a surgeon to protect people from the spread of our germs to keep you from getting an infection. I wear a mask for like 12 hours a day. It's not that big of a deal to me. Like if I'm going to the grocery store, you better believe that I have a mask on. But I do feel comfortable going about my business, taking my son about his business because, for example, we went to an amusement park and I brought bleach wipes and I made the kids wipe down the handlebars and they thought I was crazy. And then everybody else was like, oh my gosh, this is such a great idea. You need to do what you're personally comfortable with. And I don't care if I look stupid, like I'm going to wipe down the handlebar and that's the end of it. And we came back and none of us got sick. We do think we got sick in March. It was before it was like a pandemic. We were in Disney. We did a 5K. We all came back and we weren't feeling well. But we were talking about the vaccine. They're finding that herd immunity or your personal immunity is only going to last about 3 to 6 months. So this isn't like the flu, which lasts a whole year. You're going to either have to probably continuously go get your vaccines or your boosters, or you're risking the chance that you're going to get sick again. So everybody is going to have to adapt their lives to be more responsible in terms of not passing germs, remembering to wash their hands, using hand sanitizer, wiping down things that you touch, and we're going to have to find a way to continue on with our lives.
Right. And I mean, like cross-contamination. Okay, I know for me, it seems like everybody touches their mask. Everybody touches, I mean, I put on a mask, and I mean, sometimes it itches my ear, and I'm just like, God, this thing sucks, and I put it back on. But I mean, I guess some people question the fact of the mask being not as effective, being that the cross-contamination happens. And that's where I think, like, the question came from, which is, how effective is the mask?
Well, it's more effective than not having a mask.
Yeah, I agree.
So
it
right
can't
there,
be worn like below your nose. It can't be like, the earring mask. One person talking to a person that doesn't have a mask, that's going to be partially effective. But if both of you have a mask on, it's like throwing water on somebody. If you throw water through your mask, only a couple droplets are going to get through, but then that next mask is going to catch it. If one person's wearing a mask, okay, it might catch 65-70% of the droplets, but then those last remaining ones are going to land on your face.
So that's
we wore masks for our whole life in the OR because it's effective.
And that's where people are questioning, because I mean, this is some of the stuff that I've been reading, is that they're questioning that, okay, if somebody sneezes, your hands aren't protected. So if it ends up on your hands and then you go up and rub your nose, or you play with fix your mask, or like some of these people, they go in the grocery store, they got the mask on, second they step out of it, boom, it comes right off. Well, they just walked through a whole cesspool from what I'm looking at. That supermarket's like a cesspool, right? And would that not cross contaminate right there?
You shouldn't touch your face. And for us, my husband and I both do surgery. You can't touch your face because now you're not sterile. So we're experts at this, but the more you wear the mask, the more it becomes like part of you.
Nature.
My son is 15. He goes to school. He cannot take his mask off. He goes to football with his mask on, and it's just you get used to it. So it's like the more you wear it, it just is there. You don't want to be fiddling with it. You don't want to touch your face. You don't want to be touching things within your mask. You want to bring your own hand sanitizer. I sanitize my hands. Like, I come out of the grocery store, I take my mask off when I get in the car, and I have my hand sanitizer in the car, and I sanitize my hands. I was wiping down rides at an amusement park, but
I know you would
have to wear the mask to get used to it.
I have one question that is not in the script. They told me to do it. I didn't. But should I shave?
That's
Is really a beard that much of a problem?
It is.
Because
for two reasons. Number one, the virus can harbor in the beard. And number two, the masks, when you wear them, don't fit properly. I know in most hospitals, my PA, for example, had a beard. And when the whole thing started back in March, they basically told him to shave it off. So, that's, it's a known thing. Now there's a lot of people that have them, and, some of these guys that have these huge fuzzy beards look ridiculous with a mask on.
They all look ridiculous with a mask on.
Mine is not that big, and it's just ridiculous. You keep getting hair out of the mask.
Right. So it's one of those things where,
so would you say keeping it short and trimmed would be okay?
I think the shorter you keep it, and the less depth to it, and the less thickness to it, probably the better off you are.
No way, Rome. If I have to take mine out, you're gonna have to take yours.
Mine's off. See.
And an N95 mask gets sealed, and we go into like spacesuits, and they test to make sure that they're sealed. We use those for diseases like tuberculosis, which are extremely contagious, and we don't get it because we know that our mask fits. If you're wearing like a cloth mask, honestly, it's not sealed. It's catching the droplets that you're sneezing out. But, that's the point of everyone wearing a mask, because it's blocking those remaining droplets that get out. It's not that big of a deal. But if you're wearing a KN95, an N95, you're in a place where you're working very close to somebody and you have a beard, that mask is not sealing properly. I know, like, the nurses in China, they shave their heads, like the female nurses, because they truly believe that the disease was harboring in their hair. Obviously, I did not shave my head. I wear my hair in the OR up in a cap. I wash my caps regularly. But a lot of our surgeons did shave their beards because of wanting that mask to seal. Right. I think if you're like going to the grocery store and a surgical mask or a cloth mask is not that big of a deal. But if you're going to somewhere where you feel like you're at high risk and you really want that mask to be sealed, then the beard is not helping you.
So basically, it's like in the military, we have gas masks, right?
Right.
And if you break that seal, you're dead.
Yeah.
So it's kind of in that same respect as far as how that one works. I got it.
Right.
We got a question for Kate.
Good.
Kate, as a nurse, I know you encounter many different people with COVID-19. Some of them are most likely skeptical. Can you share your experience with a skeptic that caught the virus?
So I think I mentioned earlier, I think that we're experiencing a second wave. And there are multiple people that I personally work with that recently, like as in over the past couple of weeks, contracted COVID. We think we know how one person got it, and multiple people in the same department got it. And we work with these people in the OR. So now our OR is on anybody that came in like secondary contact with that person has to take their temperatures, wear a special mask. So I think it's easy to think that it's not going to happen to you until a very healthy person gets COVID, and then every very healthy person around them has COVID. And COVID is different for everybody. One person had GI symptoms. One person, literally, they felt like their head was on fire, and that was their only symptom. It was like a neurological thing. Some people get the cough. I'm friends with a very, very healthy athlete who had only GI symptoms. So it is obviously contagious. It's not like only for elderly people or people who are immunocompromised. It's definitely very real. I work in the OR. I've worked in the OR my whole life. I was working up on the floor taking care of people because we were short nurses, because either they were sick or there were just so many sick people that we didn't have a means to take care of them. So I literally had not worked on the floor for like 12 years until this year. So it's definitely real.
Right.
And the more that people take it seriously, the better. But that does not mean that we, have to live in fear. You just need to do the responsible things.
Right. And he clarified his question here. It says, more simply, he wants to know, how do people's skeptical mind about wearing the mask and all this, virus stuff going on, did their minds change after they've caught it? And now they're like, okay, it's real.
I mean, yeah, we know as healthcare workers that masks work, because if I did a total joint, say I scrubbed in a total joint without my ortho hood, I could guarantee you that patient is going to come back infected. And that's because I'm breathing on them. And that's just, it may not make sense to a lay person, but to us, it makes sense. It's the same concept with mask wearing. And I understand that it feels like they're taking away your like freedom or liberty, or, you want to just be able to go out and not worry about it. But if it's not protecting me, it is protecting somebody else that might be more susceptible, that has to go to the grocery store because they need to buy groceries, or they need to go to the drugstore. So it's a compromise that we have to make for the greater good. And it is something that is effective.
All right. So I think we're at the hour. It doesn't seem like that, but
Yeah,
we're definitely at the hour. It's been great having you, Kate and Steve. You guys have been like the coolest people I've met so far. So, and you know me, Kate.
I know you.
I enjoy having fun. So this is killing me sitting in my house.
Sorry.
But I mean, other than that, I mean, it's, this is what we want to do. We want to get the people out there to know, to get real information from people that are in the fields. Later next week, we do have a New York photographer who is a commercial photographer who's going to come out, and he's still shooting today. So he's going to have a lot of good information kind of in this realm also. And, you two are great people, and I'm so happy you guys decided to join us, because this has been an amazing photo talk. I mean, I could go on for probably another hour, but
it was really fun. I not even noticed we got 1 hour and 4 minutes, and I could stay here for more 1 hour easily.
We're talking y'all language too, right? You guys are probably like, I do this all day. So I feel you. And again, we're super highly appreciative. You guys have been awesome.
It's our pleasure.
And
Thank you for having us.
We really do enjoy having people like you guys, because it's an important topic, and it's something that's hitting everybody, not just one person. And it's good for them to know that they can still get out there and shoot and still make money without jeopardizing this whole client to photographer relationship. So that's what that was the goal of this, and I think we really got good information from you guys, and we really appreciate that.
Yeah, I think it's a very simple thing. You just do what common sense dictates.
Yeah, but just as well as I, common sense comes short.
Exactly. It's not always that easy.
Just saying, it's a fact.
No,
So
absolutely.
again, we really appreciate you guys, and I think this is going to be a wrap.
All right.
So
Thanks for having us.
no
Thank
problem.
you for joining us.
Absolutely.
Love you.
Sure.
Thanks, guys.
Have a good day.
Thank you too.
Yep.
Oops.
All
We are
right.
kind of.
So,
How was it?
yeah, I don't know. How do you guys think? Was that a good one? I mean, did that help you guys a lot? We want to know. This is.
Animal said he likes it.
Yeah,
Was
I know.
extremely useful.
Oh, you're a security director, huh? I'm a security specialist, so we're kind of right there in the same boat there, buddy. But yeah, yeah, exactly. Common sense, common sense kind of goes out the window from some smart people, right?
Yeah, I would tell that as we were talking when the internet went down, I did the shoot and it was not easy. For like several times, I just want to take the mask out and work,
Right.
It's kind of really hard. You keep the precautions, but what can you do? Just expose yourself?
Yeah. Well, I mean, we can't stay locked up. I mean,
We can't.
That everybody's going to get restless eventually. And, if you're creative, like I am, like you are, we have to create. I mean,
Exactly.
I'm over here taking pictures of Coke cans, okay? Because I'm
And
bored.
Terramana.
Yeah, Terramana, right? The last one I just did because I
Last
bought
one
it.
was Terramana.
Yeah, shout out to Terramana. Sorry. The rock was awesome. Sorry. But yeah, it's we have to find something to do, and if not, we get restless and we get tired and angry and all that other good stuff. So this show is really kind of helping us get over that, but at the same time, now we can take our knowledge and pass it on to the next generation.
Exactly. And the point is not only
Oh, thank you, Barry.
bring us, bring the information about how to take the
Don't know about
necessary precautions. Oh, thank you, man.
I don't know
But
about smart, but okay. So
but accept that we're gonna have to go out.
yeah,
Because there is still a lot of people who think they can stay locked and they will be safe.
right.
In fact, that's not true. Sooner or later, you're gonna have to go out.
Yeah, I mean, everybody goes out. I mean, you got to go to the store to get food. What are you going to just
Yeah.
eat your wood on your house? You have to leave. But it's about not being fearful. Is how I'm seeing it.
Exactly.
Everything has a risk. It's about mitigating those risks. As a security guy, you have to look at your risk factors. If a female has 102 fever the day before you're about to shoot, common sense. No, we're not shooting.
Exactly.
But
And that's when the communication getting that was what we were talking about.
right.
You shouldn't hide this kind of stuff.
Nope.
If you have the fever, just tell everybody. I have fever.
Reschedule. It's not hard to
yeah.
reschedule. So, we have to look at it from all around perspective because it's not just you or it's not just me, it's our family. So, you got your wives, your kid, I said wives, your wife, your kids.
I just have one.
And yeah, so do I. And so and then it goes even further. I mean, you got your family, like as in your mother, father, great grandma, depending on how old you are.
For the whole quarantine, I think I really saw my mom 3 times.
I haven't
I'm
seen
avoiding going there. And when I
Yeah,
go, I don't take my mask. I
I'm not
keep my
going.
distance.
If I have it or if I carry it or something like that, I don't want them to get it. So that's
Yep.
one of the reasons why I'm staying away.
Mhm.
And I call them as long as I know they're alive.
Every single day.
So, but yeah, other than that, this has been a great show. I think we got a lot of information in this one. A lot
Yep.
of stuff that answered questions that we received on our Facebook page. You guys need to check us out on Facebook. We're Photo Talk Show.
And if you didn't, where is it? I want to use it too. I want to use it. If you didn't yet, just subscribe and hit the bell and smash that like button.
Subscribe, and hit the bell. So, yeah, it's, we're growing. I mean, we're over 960 right now, which this is our third show. I wasn't even expecting anywhere near.
Yeah, me neither. I thought
I was
for us to
expecting
get
like 200 people
for get to 1,000, I thought we were gonna take like 3 months
or more. I mean, who wants
we're
to listen to
getting
me? Oh, so, but yeah, I mean, I'm starting to feel comfortable doing this, and I know we actually have stuff that's in store. Ain't that right, Alex?
Sorry, I didn't hear you.
We got some stuff that's in store that we're working on.
Yeah. You can see already on my. There is already some clues on my Instagram, on Facebook.
I'm sprinkling
page.
the magic sauce.
It will be really good. So just subscribe, keep an eye on it, because we're gonna bring some news to you very soon.
Yeah, we're working on some really good training, and it is going to be in-depth training. So from beginners to advanced, I mean, we're spilling the beans, buddy. We're not just going to go half. We're going all the way.
And not holding any information.
Yep. And we're about sharing the love of photography, and that's what we're doing, is sharing the love of photography. And again, we thank you for joining us. That's a whole hour. And I see 4 people have stayed here this entire hour, which is absolutely awesome. And
amazing.
We thank you. And I know there's going to be a lot of people watching this afterwards, probably because most people are at work right now. So
exactly.
Anyway, we love you guys. If you guys have any questions, if you guys ever have any questions, reach out to us. We are open
reach on
book.
social media.
So
we are there, and we always answer every comment and every question.
Veer said, especially photos of Kate. I got plenty of those. So, but yeah, no, this is a great show. I'm enjoying it. I'm glad we're able to come here every Thursday. We don't want to do it every day because that would kill us. It takes a lot to do these things.
Yeah, it takes a lot of work.
You have anything? Because I'm spaced. I'm actually kind of tired.
It's just, it was today was kind of really, really exhaustive for me.
Yeah.
Anyway, we just want to thank you for being here. You just want to thank you for asking questions on our Facebook page or asking questions in the chat box. We see you guys the next week with a New York commercial photographer.
All right.